So we're here today to talk about, what is a care manager? There are several professions out there that use the term care manager. We're going to hopefully elevate and educate you today about the specifics of what we do as care managers here at Elder Care Management. So probably the first layer to peel away is to explain that we are health and human service specialists, and we guide, support, and advocate for older adults and their families who care for them. That really is probably the biggest umbrella description over what we do. But I like to say that we carry a really big toolbox because, as you know, every person is different. Every older adult is different. Every family is different. Everyone comes to the aging experience with their own history. And so what differentiates our care management practice from that of other professions or fields where you might hear the term care manager is that we tailor our work to meet people exactly where they're at. And we do that by taking a very holistic and client-centered approach. It's one of the things that first drew me to the management or to the practice, the profession of geriatric care management. I like looking at a person as a whole. I like understanding what is the system that includes their family, their friends, their community, because I just think we're more than just linear people. We're complex in our makeup and our experience of this life. So as care managers, we in our practice, we belong to the Aging Life Care Association. That is our professional organization, which provides us with standards of practice and code of ethics by which we abide. And we have a variety of backgrounds and training in our practice. I have a background in social work, master's in gerontology. I'm a certified care manager through the National Association of Care Managers. And we have a nurse practitioner on our staff. We have people with experience in RCFEs, assisted living, just a wide variety, and it adds depth to our practice and just really helps inform us as we move around in serving our clients. When I was first getting my education to become a care manager, I had a class at Sacramento State, and I remember a professor telling me that care managers are like detectives, because really what we're tasked with often is identifying and problem solving. So I liked that analogy, and as I've gained experience over the years as a care manager, I've also come to think of myself as an interpreter. I don't interpret language, but I help interpret this stage of life. And so whether we think of ourselves as guides, interpreters, or detectives, we enjoy helping people. And we know the value and promote the value of planning for the future and just better equipping folks. So I mentioned the holistic perspective of care management and how important that is to us. This is a graphic from the Aging Life Care Association, which represents the 8 domains or knowledge areas in which we practice and have expertise, and where we provide assistance to clients who come to us. So often we meet folks right there at the top of the graphic where it says crisis intervention or health and disability. Those are areas where we typically meet folks because they're either struggling with a health crisis that's caused a cascade of events in their life and they need some assistance sorting that out, or some other crisis that has elevated their family or their responsible parties to reach out to somebody like us for some help. And then if we move around the wheel, we can see that the next is legal. We frequently, when we first meet a client, we'll ask them if their legal house is in order. Do they have documents that are going to support them in the way that managing their affairs and their healthcare and so forth that they desire. Often we find that they're not, that there's something missing. So that's an area of expertise that we focus on. We're not legal practitioners ourselves, but we are well versed in the basic documents that an individual needs. Advocacy is a big part of what we do on all levels. Advocacy could probably be the overlay in all of these knowledge areas, but in and of itself, we are just staunch advocates for our clients. We form attachments to them. They trust us, and we want the best for them. So wherever they're at, whatever the need is, we're trying to bring it in, help prioritize and advocate for them to have a better quality of life or the best quality of life possible. Local resources, we're resource specialists. We take a lot of time to develop relationships with other service providers in the area to become familiar with what they do and to help familiarize them with what we do so that there can be cross collaboration to best serve people. And then we network with our clients with those resources as they need them. Family, understanding family dynamics and how that impacts the process of aging is a big part of what we do, because families are a big part of all of our lives. Housing, that's a huge knowledge area for us and something that people are regularly consult with us about. The various forms of housing that are available for older adults and how to navigate, how to decide what is best for an individual. And then finally, financial, always sensitive to the reality that as an individual is aging, that their resources are dwindling, are potentially changing, helping to guide and advise the wise use of resources according to what their needs are. So this is really exemplary from a holistic viewpoint. Each of the areas that a care manager is active in, knowledgeable in, and providing for their clients. So how does that break down into the role that a care manager plays in the life of their client? The holistic approach is really displayed in four areas that really we seem to be quite active in. Really summarize where we employ this holistic thinking as we're serving our clients. So one of the signature features of our care management practice is we meet clients where they're at. We meet people where they live. They don't come to our office, we go to their office, wherever that may be. So whether they're at home, in residential care, skilled care, memory care, we're there. And we manage and attend a lot of physician appointments. We show up in the emergency room. We make hospital visits. There's been an occasion where we've had to show up in a court appearance or provide documentation for court appearances. And you can imagine the advocacy that's necessary in each one of those settings. We've developed as care managers the ability and the drive and the strength to ask questions. That's a large part of advocacy, to say what if not, and so forth, and to press the envelope at times when maybe other individuals are maybe hesitant to do so. We aren't afraid to do that. We do it in a pleasant way. We always are interested in the best for our clients, but representing them positively as well. We are a 24/7 service. We always have a care manager on call. We maintain a really strong communication in our practice so that an on-call care manager is always going to be equipped to answer the phone and answer the need for any particular client, and that is for our active clients for whom we're always available. And then we work with and refer, again, those resources to proven senior care providers who we feel can meet the needs of our clients. And that's something that we spend a lot of time doing, is ferreting out, seeing who's doing a good job, who's communicating well with us, and who's going to be there and follow through for our clients. And then we're monitoring that as they are serving our clients. It's no wonder that most of our clients are the challenging ones. There are many people out there aging without a care manager. They've got families, they've got supports in place. They're moving along through their aging journey and doing okay. But there's a fair number of folks who need us because they've got some challenges. So, complex medical issues definitely are a part of, can be a part of the aging process. And so we're not clinicians. We do have a nurse practitioner on our staff, but she doesn't diagnose or treat. She's there as a consult for us and our clients. But we're well versed in the many typical diagnoses that can occur late in life. And we're well versed as well in the advocacy that is necessary to navigate medical systems. And again, we're not afraid to help families convey those questions and concerns that they may have, and to seek the support that they need as they're navigating complex medical issues. Folks who are resistant to care. So a care manager can link arms with a family or responsible party and come in as an objective person. And because of that, we're often accepted into a client's care circle, so to speak, and can be the messenger with the message that may not have been received by other well-meaning family members or friends. I say often, not always. There are some folks who are resistant to care and will remain resistant to care. We're not miracle workers, but we're often successful. We're stubborn as well, and we'll keep coming back and trying again and again and again until we can affect some change. It may not be the initial desired change. It may not look the way a family or responsible party first thought it should, but generally by the time some change is affected, everyone breathes a sigh of relief, and then the next steps can be taken. One example of that is in-home care. We often have family members coming to us and saying, we really would like to bring some extra help in at home for mom or dad, but they just won't let that happen. And we're able to come in and become a trusted individual, trusted party. And then again, we're that third party. We're not a son or daughter trying to exert influence. We're another trusted person coming in, or a person of authority coming in and making a suggestion and gently making that introduction. Combative and aggressive behaviors or problem behaviors. Again, we come in with fresh eyes and experience and an understanding of the systems and levels of care in which people may be living. And we can offer support and help mitigate maybe disconnect between family and staff, or between the client and the staff. We can help determine triggers. We can work with communities and families. This is especially important, to have reasonable expectations of that older adult who may be struggling, and help them understand what those needs are and maybe how to better meet them and limit and decrease the behaviors. Behind every aggressive behavior, there's an unmet need, is what we've learned. And so trying to identify and ferret out, again, putting on our detective hat, becoming that interpreter, and trying to make sense and effect some positive change. For poor decision makers, nobody gets to the end of life without having made some poor decisions, but sometimes as folks age, they become increasingly vulnerable and maybe don't make such good decisions because they're fearful of change, or maybe they do have a chronic history of making poor decisions. So again, that's where our objectivity, our third-party nature might make us the messenger for something, where we can slide some more formal supports in. Maybe there's a need for working with a fiduciary, having another party assigned for making financial decisions, or again, accepting some in-home care, or perhaps excluding certain people from having contact with them. So an extra layer of support, an extra layer of safety and care and concern that's coming from an objective viewpoint. For those who are non-compliant with healthcare orders, we can come in and help understand if there are issues with competency. So is this someone who can really understand what the physician orders are, or is it not what they want? Have they been agreeing to something that they really didn't want to continue with? And is it reasonable care for where they're at in their life? An example of this would be medication management. We often encounter folks who are, still managing their own medications, but maybe because of some increased confusion, they're struggling with that, or maybe they just don't want to take those pills anymore. So we can help evaluate what's the issue here with the non-compliance or the resistance or the inability to follow through with the healthcare orders, whether it's medication or lab work or anything else that requires some follow through. Mentioned in that slide there with the pie slices about family systems. So families don't always agree about the care that their loved ones need. There might be a history of conflict in a family, and then an aging loved one with problems that begin to surface and consume time and energy that can increase the strife and conflict in families. Often we find ourselves educating families about where their loved one is at, especially in the cases of memory impairment, cognitive decline, dementia, Alzheimer's, understanding, helping them understand why are mom and dad behaving that way, helping them understand that it's not about them, that it's not that something's wrong with them, it's that there's a disease process happening. So a lot of times a little bit of education goes a long way there. So we work to elevate and educate and work toward consensus when it comes to families not being able to agree. Victims of financial abuse. Sadly, this is a problem that is just increasing exponentially in our society here. So we are mandated reporters. When we suspect that there is financial abuse or physical abuse or emotional abuse, we are required to report that. But so we're looking when we're getting to know people to make sure that they're not vulnerable in some way so that they won't be a victim of financial abuse. And again, educating families and responsible parties about that. We've unfortunately had a fair number of clients who were vulnerable because they had informal caregivers coming into the home who exploited them financially. And, you know, people wonder how could this happen? How could someone who seems to, you know, be able to write their own checks and so forth know that they shouldn't write a check to someone for $5,000 or more? Well, they become dependent on people who know how to exploit them. We also have, you know, so many cases now of fraud over the computer and other digital devices. So even the phone still. Finally, those individuals who we call dual diagnosis. So they've got perhaps an undiagnosed mental health issue, maybe that they've lived with for the greater part of their adult life. And now they have an onset of a dementia diagnosis. So we're meeting more and more individuals like this, where we're a part of the team trying to determine what's what and what can be addressed and how can we best meet this individual's needs. They're complex and they're really an underserved group of individuals. And so identifying the resources that are available to them and strengthening their safety net is an increasing part of what we do. So who's the ideal care management candidate in light of all of that? Well, for some of our clients, it means that their family is involved, but they're not local. Families, by nature of just the way our culture has evolved, kids grow up, they go away to school, they stay in that community where they went to school, or they take off with their career and they're across the country. So we like to think of ourselves sometimes as the boots on the ground for those families and those older adults, because we are here, we can provide the oversight and report to that family from out of the area. Some of our clients don't have any family involved in their care and well-being. They might have a sibling who is also aging and not able to assist, or they have strained family relations. So in those cases, we are standing in to assist with assembling that support and monitoring that plan of care. We're not decision makers by any means. We will refer individuals like that to fiduciaries and other folks who might be able to accept that assignment as an agent for them. Again, sometimes families are unable to agree on a plan for aging. So one sibling might see a deficit and think that, and have safety concerns and think that it would be better for a parent to go into a different level of care. And another sibling might think that the priority is for that parent to stay at home. So we can be a part of that team and help, elevate the conversation and keep the parents' needs at the forefront, and also hear what that older adult's priorities and cares and concerns are, and help put together a plan and move it forward. Complicated family dynamics, the same way. We're not professional mediators, but we pretty regularly sit down with families and help ferret out what's the priority. Everybody needs to be heard, but bringing it in, reining it in. Emergency events can often overwhelm family and decision makers. So emergencies are not foreign to us. We deal with them regularly for clients. And so we're often just the calm voice in the room, reminding, encouraging, guiding, advocating for. Conserved individuals. We do work with a number of local fiduciaries and folks who act as conservators for those who need to be conserved. And again, we're often the soft touch, the psychosocial nurturing around that client as the conservator or the fiduciary is acting in their role. And then finally, a challenge that family or support system is no longer able to manage. An example here is I had a dear client for a number of years who she had a sister. There was 14 years between them. They were very close. It was more like a mother-daughter relationship, but they were very close. When the elder sister developed Alzheimer's, everything changed. Her younger sister was devoted to her and had done a fabulous job of helping to manage her care and her life for her up to a certain point, until the Alzheimer's reached a stage where the sister became suspect of her, and really the negativity came out and became focused on her younger sister to the degree that she could no longer visit. It created agitation for the sister with Alzheimer's and tears for the younger sister. So I became the in-between sister and provided those regular visits, engaged with the support staff in the care home where she was living and so forth. So, and fortunately, toward the very end of her life, they were able to reunite and have some sweet time together. But sometimes that's the reality of that particular disease process. And so we have the opportunity to serve families in that way when circumstances become stressful. A big part, I mentioned this earlier, of a kind of a signature feature of care management, the way that we practice it, is that we see our clients where they're at. And it's one of the things that first drew me to care management versus more traditional social work, is that I love to experience and see what my clients live like and in day to day. Who are the people in their world? What do they call home? I get to know and better understand them, and what makes them tick by doing so. So as a result, we regularly find ourselves in a variety of settings, everywhere from home to skilled care, as you can see here on the screen. And we have the benefit then of developing that rapport with the staff, the support teams that are caring, doing the hands-on-hand care and support for our clients. If our clients are at home, then it's the family system. We're getting to know who's the family caregiver, or who's the in-home care team, who's the hospice team, and so forth. So and we're well versed in all these levels of care and what it takes to administer care in them, and how to evaluate, is this the appropriate level of care? Or is it time to think about a move? Is a move necessary? Or how can we change things up so that a person can stay in place, whether that's home or assisted living or even a board and care? Care can at times become very complicated, and we get as creative as we need to be, and as resources can allow. So, one of the current challenges in today's world is the labor shortage, and we're seeing this, assisted living communities especially impacted by this. So I think it speaks even more to the importance of our collaboration and support of clients in those settings. So wherever our clients are, that's where you will find us. So this is a common question, is, who covers the cost of care management? So it is a private pay, out-of-pocket fee for service. And rates in general for care managers, depending on the location, can range anywhere from around $120 to $200, depending on the level of service. Some care management companies charge extra for after hours. We have a flat fee regardless. Some care management services can occasionally be reimbursed by long-term care. I've seen this seldom, but it does happen. We don't have a minimum contract or operate off of a retainer. but we do require a minimum monthly visit to assess our clients' changing needs. This just makes us better historians and advocates when we're assisting them. So that's really our only minimum requirement. You know, I like to attach value to our services and the cost of what we provide by helping families understand what it costs when they have to take time off of work, when they have to take vacation pay, when they've got to purchase that last minute plane ticket because their loved one has fallen or is hospitalized or is in crisis. We can be there standing in for them, reporting and helping them determine when is it time to come. So a better use of their resources as their loved one is aging. And then just the value of the peace of mind of knowing that they've got a partner in this journey. So, and speaking of value, again, saving a family time and money. So there's not a need to immediately respond to an emergency. And we have a current client who's been in the emergency room 4 times in the last 5 weeks. Their responsible party does not live locally. We've been the one showing up in that emergency room, mitigating and advocating for her. So again, advocating for clients in the emergency room, acting as historians, reporting back to family, making sure that residential care communities are getting the orders that they need to carry on with care. Making sure that advocacy happens in the doctor's office is very important. Often as folks are aging, turning the corner into the late 80s, the early 90s, not only does getting to the doctor's appointment become a challenge, but accurately reporting does. We are getting to know our clients wherever they're at, wherever they're living, and we are attending doctor's appointments and making sure that the doctor's getting an accurate picture of what's going on day to day with their patient. Sometimes doctors are a little taken aback by our initial presence. However, it doesn't take long before they too recognize the value in our presence for their patients. They see a continuity in care that is smoother. They see clients taking medications. They get feedback that they weren't getting before, which helps them make better decisions. And then the healthcare that their patient is receiving is of greater value as well. So we respond 24/7, as I mentioned before, with an on-call schedule and care manager who's always assigned to answer the phone and can either deal with an issue by providing information or responding by showing up in the emergency room. So just the value of the peace of mind that we bring is important for a lot of our clients and the families, their families whom we also serve. And we have just the pleasure of developing relationships with that client system that brings a real depth and joy to our work. Resources in senior care is another area that we specialize in. We work really hard to develop relationships with other community service providers. Again, getting to know them, how they operate, helping them understand what we do and how we can collaborate together to best serve older adults and their families. So whether that's fiduciaries who a fiduciary can help to manage a trust, become a trustee, manage the finances for perhaps an older adult who's compromised and can't do that for themselves, who maybe has a family member who's either out of the picture or otherwise unable themselves to take on that role. So we're seeing an increasing number of fiduciaries and an increasing need for their services. Conservators. There are at times when a conservatorship becomes necessary. The circumstances are usually difficult, We have a number of family members who are conservators for their loved one. And we have, and also work with professional conservators or court appointed conservators. We're finding more and more that this is a very difficult role for family members. So we're cautioning and counseling family members who are considering this, and also older adults who may think that at some point, if they need a conservator, they'll just have a family member do it, to think twice about that. Because conservatorships generally happen when things are difficult, it can cause further strain in families. So financial advisors, older adults often arrive at that season in life where they've worked very hard to store up and save for this season. And so they're working with financial advisors who often recognize that there may be some developing concerns. So we're very appreciative of that, because again, hearkening back to the issue with the rise in financial scams and frauds and abuse. We want to do everything that we can to prevent that. When we encounter a client who may need assistance, maybe they have not taken care of or invested, their savings well, then we're going to refer them to that trusted financial advisor. One of the resources that we heavily use in our practice are concierge physicians. These are practitioners who typically visit the clients, their patients, where they're at. So a house calls doctor. And it really is, especially for our physically challenged and frail older adults, or for those who have serious cognitive impairment or dementia, the use of the concierge physician can make all the difference in the world in the quality and care support that can be provided to them. So we really take great joy in working with the concierge physicians and referring to them. And we often find that our clients, they say, really, there's someone who will go see my mom, in the memory care unit. We don't have to take her out. We don't have to, give her some medication first to calm her down. No. We can bring those services in. Home care agencies. So I mentioned in-home care earlier. We network with several wonderful agencies who we've developed relationships with to serve those clients who need that service. And in communication is so important, especially with in-home care, because those care partners who are coming in and sitting with an older adult and providing perhaps assistance with activities of daily living, bathing, dressing, using the bathroom, transferring, maybe they're assisting with some meal preparation and so forth. They're spending extended amounts of time with our clients. So we really want to know what they see, what's going on with our client. And so we like to work with agencies who can communicate well with us, and who are going to use place care partners who have the experience and the profile that we're looking for quality care. And home care also, in-home care providers, I just want to note, don't just work in the person's home. Sometimes we utilize that service in an assisted living setting to supplement a client's needs. Maybe they've just returned from a hospital stay, or they're having that series of emergency room visits, and we need some extra eyes on. So we'll utilize and refer at times for those reasons as well. Hospice providers. We're meeting people at a time in their lives when dying and the death process is a reality. And so helping families and our clients determine, is it maybe time to talk to the doctor about a hospice referral? and then which agencies might best serve them. We've developed some working relationships with several hospice providers who just go above and beyond in serving clients. So hospice is a wonderful support at the right time in life when it's needed. And we're so glad that we have that as a resource in the work that we do. Home health is another area with service that we interface with frequently, especially for clients who need that extra assist. Maybe they're recovering from an injury and a hospitalization, or maybe they're just experiencing a little bit of a decline and need some extra assistance. We often find that people don't understand or know that they can ask a physician for a home health referral. We need to get a little extra physical therapy in the home. These are short-term services, or we need to get an evaluation to see if there's an issue with swallowing. A speech therapist can come out and do that. An occupational therapist can come out and help a person learn how to more efficiently dress, or can help a caregiver learn how to more efficiently assist their client. So home health is a great resource. Again, short term. Home health is a Medicare benefit. In-home care is not. That's out of pocket. So there's a difference. There are different roles, but still very helpful tools in the aging process. Mobile labs. This kind of is a part of the concierge physician's role, but again, knowing that a mobile X-ray could be ordered to see if a bed-bound individual has pneumonia, or that a blood draw, a lab draw, could be accomplished at home, so that or in memory care for a person who's a difficult transport, that there are other ways to accomplish these things that need to be occasionally taken care of. So we've identified those, and we know how to liberate those resources for folks. And under that same umbrella, mobile dentists. This was one I didn't know about for a long time, and I was thrilled to discover. We have collaborated with a mobile dental hygienist who is the most gentle spirit, and can get just about anybody to open their mouth and let her clean their teeth. And she goes right to the home or whatever setting the client is in. So, and that's just an example of the type of care that can help increase a person's comfort towards the end of life, especially. And there are more. We keep an internal resource guide here in our practice, where we make note of all of these relationships that we've developed. And when we first meet with a client and their family or their responsible party, we do our own assessment. And if they would like for us to, we will develop a care plan and make suggestions for these resources. And then we will help create the link between the resource and the client. And that's, I think, one of the things that we enjoy the most. And we have a few unique resources too. One especially that I enjoy, they're called recreational specialists. And what they specialize in is bringing personal activities and life enrichment to clients. And so there are a developing number of groups out there who do that. And we just see the benefit of that kind of interaction. And it's, we've especially noticed their impact on those clients who perhaps were isolated as the result of the COVID lockdowns and so forth, or just isolation in general. They're especially effective at going in and just very gently opening up their world and providing that enrichment. So another example of the unique resources that we've developed relationships with. So why choose elder care management? What makes us unique? One of the things that I think makes our team so wonderful is our sense of collaboration. The very nature of our work makes us autonomous. The care managers in our practice, they're out every day serving their own individual clients. We collaborate on many levels with a daily check-in. We have a fabulous electronic platform that we use that's HIPAA compliant, where we store information about our clients so that we can cross-share and have it available. We do team meetings. And so we're constantly there supporting one another as we're working independently in the community. Together, I know we have well over 50 years combined experience now as our team is growing. Again, we provide that 24/7 support for our clients in emergency situations. And we're serving the greater Sacramento area now. We have clients in Placer, Sacramento, El Dorado, Yolo County. And it's just a real pleasure to see as our team grows, our ability to reach further into those areas. I mentioned earlier that our team includes a family nurse practitioner she's a wonderful resource for us to look to when we have questions about client care or health concern or a diagnosis that maybe we need a little bit more information on and so forth. And then the other thing I think that makes elder care management unique and special is our commitment to community education. Presentations like this, we're back live now in the communities as well, able now to do some in-person presentations. We are really committed on every level to elevating and educating the understanding of aging, aging life, quality of life, and what we can bring to the equation to help better improve quality of life late in life. So we're committed to educating our clients, their families, the community, the aging services providers that we interact with and so forth. And it's just an all-around collaborative effort. So it's kind of my word for us is collaborative. And the reason why I think that we have so much to offer. And that really can be encapsulated, I think, in the individualized support that we provide. We do initial phone consultations with those who are making inquiries. Generally, I'm taking those calls. Sometimes it's one of our other veteran care managers. We're trying to help callers identify if we are the appropriate service or not. And I'm often saying, I think someone else could better meet your need, and I'm referring the caller to one or two other service providers who I think they should speak with. We do care assessments that are catered to a person's individual needs. Again, what is unique about our care management practice is that we're looking at that individual client, that client system, and what makes that person unique. What are they arriving at this point in time with, and how can we structure and propose a care management plan around them to best serve and support them. Sometimes that's a written plan. Sometimes that's a conference call with a family or responsible party after the fact. So sometimes we dive right in and say, there's a problem and we've got to deal with this problem right now. And then we work backwards and then assess and propose and so forth. So it can be often is a very fluid experience. We enjoy following our clients as their journey progresses. We modify as we need to. We make and propose changes as we need, as are needed, and suggest those to their decision makers. So again, we're acting as that guide, as that interpreter. Ongoing care management. We go the distance with our clients as far as they want us to go with them. We do. I have had the pleasure of knowing and providing care management oversight for so many people now, and a fair number with whom I've walked to the end, where I've been bedside at the end of life, and I consider that such a privilege. And I've gotten to know those clients' families and that client's history, and it's really the one most wonderful privilege to experience that. So we hope that we can reach more people in the community with what we do, share the resources that we have developed, and share the resources with people who need them, and direct them to folks who can help them, whether it's us or someone else. So I think we're going to see if we've got a few questions going forward, and then do we have any questions, Maureen?
Thank you very much, Felicia. I'm going to go ahead and stop the recording, and then we will move into the question and answer session.
Okay.